Welcome to Med Talks with Medical Crib. Today I have with me Dr. Sharad Joshi, who's a principal consultant, pulmonology at Max Speciali. He'll be talking about mucormycosis, why is it happening post-COVID, and what are the treatments available, and how it has to be taken. Welcome, Dr. Sharad, to Med Talks.
Thank you.
Mucormycosis is being talked a lot, and it is happening mostly in post-COVID patients. So, what is mucormycosis, or what is this black fungus all about?
So this is a fungal infection which is happening very often in the post-COVID timing when the patient's immunity is very, very low. All right. So this is not a new thing. Why everybody is talking about this now is because of the increased frequency, because of the number of cases now we are getting in the post-COVID era. That is the reason everybody is talking about it. It's not a new disease. Like the COVID-19 is a new disease.
Yeah.
The first cases we got of COVID-19 was in December 2019. But mucormycosis, it's an old disease. But unfortunately, because of relation with the COVID, because of various factors related to COVID, the incidence of this particular disease has increased a lot. And that is why everybody is talking about it.
So, why is it happening post-COVID? Why after post-COVID? Yeah.
So basically, you have to understand that fungus is ubiquitous. So there are variety of funguses, and they have their spores. They have their own budding yeast or septate chains, and they are ubiquitous. So fungus is everywhere. They are mostly in soil. They are mostly in biodegradable or organic decomposing material. They are there in whenever there are uh, winds or there are dust storms. These fungal spores are more in the environment. All right, that you need to understand. So these fungus are present ubiquitously. They are inside our indoor environment. They are outside in the soil as well as the decomposing organic material. Now, what happens is even there are few spores of typical certain fungus which is there in our nasal cavity or in the sinuses, and they are suppressed because of the common flora, the friendly bacteria of our body. But unfortunately, during the treatment of COVID, what is happening is that patients are being prescribed lot many broad spectrum antibiotics. They are prescribed with steroids. Their immunity is going down because of fight with the virus, and there are typical cells in the defense in the immune system which are typically very very low. They are getting very low in the uh, fight to the COVID, and that is all leading collectively in the development of this fungus and causing the disease. So mucormycosis is a disease of nasal cavity, sinuses. It may spread to orbit or the eye cavity, and then it can also ascend to the brain. That is how it is happening, and it is very very fatal.
What are the symptoms of mucormycosis, or when a patient need to identify that I may have this and I have to go to a doctor?
So in present perspective, if you talk, this black fungus or mucormycosis in post-COVID patients is mostly affecting their nasal cavity, their sinuses, their eyes, or uh, the nerves of the eye, and then the nervous system or the brain. So whichever organ is involved or is affected by the fungus, the symptoms will be according to the that particular organ involved. So whenever the nose or the nasal sinuses are involved, there is nasal stuffiness. There can be foul smelling discharge. There can be dark or brown or black color discharge from the nose. There might be sneezing. There might be swelling over the face and then pain, which this pain and swelling might involve to the eyes. Whenever the eye is involved with this fungal infection, there will be blurring of vision. There might be diplopia, which is like double vision, or there might be in an extensive disease there might be loss of the vision because of the complete damage to the eye. And when this fungus is ascending to the brain or cerebral or the rhinocerebral mucormycosis, definitely there is drowsiness, there is agitation, there might be photophobia, all these symptoms and headache. These kind of symptoms will be there with mucormycosis.
What is the mode of transmission of black fungus?
So transmission of fungus is definitely aerosol or air, because there are spores of the fungus which are floating in the air. So whenever there is dust storm, or whenever there is dust or um, high winds, these spores can come up in the or maybe suspended in the air. They come up from soil, they come up from the organic decomposing things. So these fungal spores, they are trapped inside the nasal cavity, they are trapped inside the sinus of the nasopharyngeal sinuses. Now whenever the immunity goes down, these spores will germinate and will form the growth of fungus. All right. So it is not a very infectious disease like the coronavirus, which spreads from one person to other person if you don't keep if you don't take care of the social distancing or covering the mask or something. So it's not that infective. The fungus is not that much infective as a virus, but the spores are suspended in the air, especially with the winds or with the dust storm, and then they get deposited inside your nasal cavity or the sinuses. And whenever your body immunity goes down, whenever you are on high steroids, they can germinate and form fungal colonies, leading to disease. All right.
Sir, what are the treatment available for mucormycosis or black fungus?
So when there is an infection of fungus, we talk about antifungals. And also, unfortunately, if you follow last 7 days news, you can find that even from the market, these antifungals are not available. So because of whatever reasons, the antifungals are not available. And specifically for these invasive fungal infections, for rhinocerebral mucormycosis, we need a high-end antifungal. Most of them is the two antifungals which are actually approved for these kind of infections. One of them is amphotericin B, which comes in three different forms, and then there is a posaconazole. So these two drugs are available as antifungal treatment. Then there is a surgical aspect of management of mucormycosis, because you need to go ahead and debride or clean the nasal cavity by endoscopic procedures or by open surgical procedures. And whatever bones or sinuses are damaged, they need to be thoroughly debrided or cleaned while with the surgical interventions. So the treatment of mucormycosis involves both the balance of antifungal treatment and as well as the surgical intervention.
So, sir, like you said, the treatment is amphotericin, and what is the message that you want to convey out to the people out there about mucormycosis or black fungus, which people are really scared of, also maybe because they are not getting the medication sometimes.
So for the general public, there are few things which they need to know. It's not happening to everyone who is affected with COVID. One and foremost thing is that black fungus is not affecting everybody who got infected with the COVID-19 or coronavirus. One thing. Second thing, the fungal growth increases with the uncontrolled sugar levels, overuse of antibiotics, or unjudicious or unmonitored use of steroids. So these things are to be taken care, that you don't overuse antibiotics, you don't exceed the doses of steroids, or you don't prolong the use of steroids, because all these things will lead to increased growth of the fungus. And definitely if you are a diabetic or if you are on any other immunosuppressing drugs, then you need to take care of your blood sugar levels and contact the concerned doctor as soon as you suspect or as soon as you get the first symptom of mucormycosis. So, alarming signs: if you have a stuffy nose, black discharge from the nose, or there is blackening of your oral mucosa or tongue or palate, then you definitely go ahead. Or you have headache and swelling over the face, you go ahead, consult with the ENT, get a CT or the MRI with the advice of doctor, and then proceed for the treatment early.
Thank you, sir, for joining us